Eddie. I'm your physical therapist today. I'm going to do your pulmonary assessment to make sure there's no red flags before we start your therapy. What it entails is that I will check your thoracic area, your chest area for any swelling, redness, or anything that needs to be addressed. I'm going to look at it, palpate it, check the bony prominences, and make sure that everything is good. And the position of the patient will be in a seated position, feet flat on the ground, sit straight. The outfit must be enough that I can see the skin, I can see the bony prominences. Okay, if that's okay, I'm gonna start the assessment. With your permission, it's not invasive. Okay, I'm going to start assessing your bony prominences. We'll start on the anterior portion of your body, the front area. Okay, I'm gonna start in your sternum, or called as a breastplate. Okay, with your permission, I'm gonna palpate. Okay, does it hurt? Okay, you didn't have any access when you were younger, right? Okay, right. This is a sternum here, from here, and then on the top of it is suprasternal notch. And beside it are the clavicles. The clavicles are good. I'm being gentle with the palpating, and some patients can tolerate too hard presses on the bony prominences. Alright. Just there. It's equal and everything. Alright. Okay, if you could, I'm going to check the back. If you could turn sideways a little bit to your left. Alright. Okay. Alright. On this side. Alright. I'm gonna check the scapula. The two blades will come back here. Then right. I'm gonna move the shirt back a little bit, okay? This is spinous process. The scapula goes up here. Good. Go. Good. I'm gonna check our vertebral spine, okay? Does it hurt here?
No.
Cervical. You turn your head to the left. Good, and then the right. Okay, back in neutral. Okay. Alright. 7. CO2 C7. T1. 12. Alright. Do you hurt anywhere? Placing the hands here. Equal. And the inferior portion of the scapula. Spinous process. To check your chest movement during breathing, okay? The normal respiration, it will check the anterior posterior movement of your chest, and then compare the transverse movement, okay? It will be like a normal, like 14 to 18 respirations per minute, okay? I'm gonna check it, okay? Just breathe normally, right? And good. I'm watching the rise and fall. Okay, all right. Everything's equal. No, everything's symmetrical with the movement. Lesser movement on the anterior posterior compared to transverse. No barrel chested, so no difficulty on your posture. Everything is equal. You're not on labored breathing. You're not showing signs of use of your accessory muscles. And we have a collagen therapy, it's a tripod position. Labored breathing, and the patient is like this. Most of those are COPD patients. So far, you're breathing normal, and your facial expression looks good. No shortness of breath or anything. So everything is normal. Okay, now I'm gonna check your level of consciousness. Okay, can you give me your name?
Karen Dela Cruz.
Okay, give me the date, day, and year.
November 14, 2025.
Okay, so you're alert oriented means you don't have any signs of confusion which means there's no hypoxemia. You're getting enough oxygen in your brain, so you're able to be aware of your surroundings and situational awareness, which is very good sign that you're breathing normal. Okay, you're getting enough oxygenation. I'm gonna check the symmetry of your breathing by putting my hand on the back of your back area of the spine. Okay. All right. If you could sit facing that way. All right. Okay. Okay. I'm gonna move the shirt up. Okay. So I'm gonna find here. I'm gonna put my hand on the 10th rib. The iliac crest here. First bone here will be the 12th rib. Okay, the hands will be the 10th rib area. Okay, inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, good. Everything's symmetrical. And you're breathing. Alright, okay, good. Okay, turn around again here to your right. Okay. Alright, no asymmetry of movement, it's all equal. So no abnormalities. You know, it's good, everything is equal with your movement of your chest. And asymmetry would show pneumonia, pneumothorax, or any other pulmonary conditions. So everything is normal. Okay, now we're gonna assess for tactile fremitus. The patient would be the back facing me, alright? And if it's increased fremitus, it's either consolidation, and if decreased fremitus, it's pneumothorax or fluid in the lungs. Alright, I'm gonna put my hand here. Alright, okay, I'm gonna check your lung, okay? So you want you to say 99.
Okay.
99,
99,
99,
99,
99,
99,
99,
99,
99.
99,
One more thing. 99.
99.
Alright, okay, there's no abnormal vibrations or anything, everything's normal. Take your chest for any lumps or any abnormal protrusion I see, okay? That would indicate probably like a tumor or any lesion or infection, okay? Alright. Alright, if you can face that away. Does it hurt?
No.
Good. No lumps. Then does it hurt when I press on it?
No.
Your 12th rib here. Alright. Okay. Alright, you can face that away. Okay, alright? Good. Okay, that's normal. Okay, good. Okay, I'm gonna listen to your breath sounds. Your lung sounds, okay? So take a deep breath, okay? Okay, I'm going to clear that region. Okay. Vesicular breath sounds is normal and symmetrical throughout. All right. Okay. No abnormal breath sounds detected. It means if you have you do not have any lung or pleural issues that you might encounter. Okay. Okay. I did not hear any adventitious sounds during the auscultation of your lungs, which is there's no crackles, no wheezing, no pleural rubs that could indicate any airway narrowing or any inflammation. Okay, I'm gonna gently tap on your chest and shoulder to check for resonance. Okay, if it's abnormal resonance, it's not good. If it's dull, it means it's consolidation. There's something in the lungs. If it's hyperresonant, that's not also good. Okay, I'm gonna check for resonance. I'm gonna gently tap on into your chest and your back. Okay. All right. Your face a little bit to your left. Okay. Okay. So far, your lung assessment is a resonant and all field, so it is normal. I did not hear any dullness that would suggest consolidation, that would suggest fluid field or any pus that would cause a dullness of sound. I didn't hear any hyperresonance that could suggest increased air in the lungs that could say in pneumothorax. So far, your lungs are resonant in all fields. I will gently tap to see your diaphragmatic movements, okay? All right? All right. Okay, I would like you to breathe out fully and hold. Good. And then I want you to breathe in as hard as you can and then hold. Okay, 4 cm. Okay, and breathe out and relax. Okay. You have normal chest excursion, diaphragmatic movement at 4 cm. If there's any asymmetric movement, it suggests phrenic nerve injury, effusion, or any lung masses. So far, it's symmetric and it's normal. Your lung screen today is normal. If I had found any abnormal lung sounds, asymmetry, or signs of distress, that I would refer you to a physician. So far, everything is normal. This concludes my pulmonary screening. All findings are normal. Any abnormal findings will require referral to a physician before continuing physical therapy. Thank you.